This miracle story made possible by Papa Murphy's.
Good job. Good job.
Matthew is 2.5 now, and he's pretty crazy.
Typical 2-year-old. He's definitely 2 babies in one. When he sleeps, and when he's up, he lets you know he's up.
Nobody said the terrible twos are easy.
Breakfast, yep. Gotta sit on your chair, please.
But these parents wouldn't have it any other way. You see, Matthew's birth is nothing short of a miracle. Early on in the pregnancy, during an ultrasound, Kay and Bobby found out there was a major problem.
In Matthew's case, the problem with the heart was that his chest was full of fluid, and that fluid was pressing on the heart and the blood vessels that feed the heart, that made it so that he couldn't get enough blood back into the heart to help it pump. It's essentially fatal. Untreated, the vast majority of these babies will pass away before they're born.
Kay and Bobby were given a few options, and one of them included a first-of-its-kind fetal intervention procedure. This would be the first time doctors would perform this operation at UC Davis Children's Hospital.
So we give the fetus some medicine to reduce pain and to reduce movement. And we place that through the mother's skin, through the uterus, into the amniotic cavity, and then using ultrasound, we find the right spot on the baby's chest, and then we place that large bore needle into the baby's chest and drain the fluid out and deploy the small tube through that needle.
The procedure was delicate and long. Part of what kept this couple fighting was the memory of Mia, their daughter, who was stillborn years before.
Because I just keep thinking, like, God, all these people have kids and they don't take care of their kids, and all we want is a baby. You know, we're not asking for much.
The operation was a success, but the danger wasn't over. Shortly after, Kay went into labor at just 33 weeks.
Even after that, he still fluids kept building up in him, so he still had to shunt in him and constantly draining.
Mommy every day will read you one story. Let's see how that sounds.
After a few months in the hospital, Matthew was finally able to go home. But
You know, the first year was scary because we had to keep him in a bubble, you know, couldn't allow anybody to come over. We used to have this, like, little hand sanitizers all around the house. First year, like I said, it was just rough. It's scary because, you know, he'd get sick, he'd be right back in the NICU. After that, after his first year birthday, it was just nothing but fun.
And in spite of his prematurity, has turned into a wonderful little boy and has had very few complications, if any, from his prematurity. So I would expect him to have a fairly normal life.
Whoa!
only a dozen locations nationwide offer this kind of surgery. UC Davis Children's Hospital is one of those few locations.
Medicine today and doctors today are amazing. You know, they're great. So I knew he'd be okay. Especially when everyone was like, "Wow, that's a hydrops baby." I was like, "Okay, my son's gonna make it. He's a fighter."
A little fighter with a big will to live and rule this household.